Hi, I'm Dr. Mike Milligan. We're here at the ADA meeting in San Francisco, so there's some background noise, but you really need to hear this. I'm here with Neil Romano of Quadex Pharmaceuticals. Neil, thanks so much for being with us.
Thank you. Great to see you, Doc.
So we're talking about the oral herpes virus.
Right.
And tell us a little bit about the prevalence of that.
You know, Mike, let me just start by telling you that I come out of a disease prevention, health promotion background. That's what I did.
Yes, you do.
And over the last 30 years, I've looked at a lot of issues. And I actually became involved with Quadex the first time because the prevalence of oral herpes, the danger associated with it is so dramatic that I actually was looking for answers to it, actually bumped into a Nobel Prize team person. I said, what's good out there, what's happening? And he actually directed me to this company 11 years ago. The prevalence of oral herpes, also known as cold sores or fever blisters, is about, just about everybody has it in their body.
About over 90%, I think.
Over 90% of the people, and that's worldwide.
Yeah.
And people think of it as a nuisance.
Right.
It's not a nuisance. It's, you know, I have to tell you, Doc, people have to realize something. First of all, you touch a cold sore, and you touch your eye, the potential of herpes keratitis, which is the leading cause of blindness, is possible.
Herpes keratitis, the leading cause of blindness. I had a hygienist in my office who did that.
Right.
And took it from, we don't know where she got it on her finger. She got it there, could have been from a patient, took it to her eye, had a lot of problems with
You know, and the interesting thing about that is even if the dentist is gloved or the hygienist is gloved, I mean, you still can touch it, you can still touch something. I mean, it's a virus that lives a long time even in a dry environment. It is a ruthless 24 hours in a dry environment. And it can be transferred to other parts of the body. People recognize that. But there's also things like encephalitis and so on that go on. So it's not, you know, even though it's second only to the common cold as a virus worldwide in prevalence, even though it's second only, it's a lot more dangerous. I'd much rather get a cold any day than get it. Plus, let's also talk about the fact that it's disfiguring. I mean, and we get these viruses when we're under stress. We get these viruses in changes of weather. We get these viruses when we're immune suppressed and we have some problems with our immune system. So if we're sick or we're tired, the times you don't want them, more often than not.
For me, my wedding. My wedding night, I had a cold sore. I couldn't kiss my wife on my wedding night.
That's something that creates a problem. I hope it got better after that.
Better.
Okay.
United Airlines, I was on a flight, and the stewardess told me that if someone from United, a stewardess, has the herpes virus, they send them home. They say you can't work today.
Well, I mean, even if you touch it or you touch something they've touched, you still have an issue of you can get herpes Whitlow. People get it in their hands.
That's what my hygienist has.
And dentists have lost, and hygienists have lost their careers to losing their fingernails and losing the sensitivity in their hands. So this is not a cold. All of those things are indications of big problems, okay?
Absolutely.
But let's talk about the 2 weeks of pain and suffering for a person.
Absolutely.
Let's talk about the fact that, you know, very honestly, you're the guy or the gal going to the prom.
Right.
That's problematic. I mean, I have young daughters. I have a 17-year-old. I mean, she gets a blemish or something, it is problematic for her. Frankly, I've known people who have canceled business meetings, men and women that are friends of mine that have told me, I've canceled business meetings because it's disfiguring. It's, people see it and they're, you get a large rash and you're weeping, and all of those things don't make for the most,
Patients cancel appointments.
Well, we did a survey at Quadex Labs related to this, and we found that of the 40% of Americans who get cold sores and get one about every 3 or 4 months, that's generally about the prevalence, of those, 1 in 3 have canceled a dental appointment.
1 in 3.
Yeah, because they've had, and the interesting thing there is that we also know from data that people who cancel appointments, about 50% don't come back for that appointment. They either skip for an entire 6 months and never come back. So that's not trivial to the practice from a financial model.
Absolutely.
Plus the fact that my feeling is, and the feeling of a lot of people is, we'd love to get them in the office to get them treated, because that's a really important thing, because once again we go back to the fact that this is a dangerous virus.
Right. Well, let's talk about possible treatments out there. I know some dentists like to treat them with lasers in the office. Some, I've even heard ozonated oils. I don't even know if that's legal at this point in the United States, but in other countries. And then, of course, there's the some of the topical medications. So most of those that I'm aware of just coat the virus, don't really kill it. There is Viroxyn, which actually is a single dose rub-on topical application that actually kills the virus.
Correct.
Tell us a little bit about Viroxyn.
You know, it's a little different. First of all, Viroxyn is formulated exclusively for professionals. My feeling is, and it will only be sold through dentists. That's the only place you're going to get it. And the reason we did that, Mike, very honestly, is because this is such a serious situation.
It is.
That we want to make sure a professional talks to a person with a cold sore and gives them that information, and then gives them a treatment that actually works in the dental office.
Right.
Viroxyn is formulated with an active ingredient, BZK, but then it also has benzocaine.
Right.
The benzocaine is in there so that the first thing you do is on your cold sore, you dab the product onto your lip. Right. It deadens the area.
Right.
If you've ever had a cold sore, it's not something you want to touch a lot. Okay?
Yeah, it's sore.
And with the applicator for Viroxyn, by the way, you never touch it. It has a little separate brush, and you never touch it because we want to do that. So you deaden the area first. Then there's that little bit of a crust when you have a cold sore, and that's that thing that's on the outside. You use the little brush end, and you brush away while squeezing the medicine into it, and then it disappears. You know, you've deadened the area, and the medicine disappears transdermally. The virus itself has what's known as a fatty cell covering on it, a lipid coating.
Yep.
The active ingredient, think of it as a detergent. What it does is it touches the oil and bursts the cell of the virus, as opposed to trying to neuter it, trying to stem it off. So it's literally killing it, preventing it from spreading. Right.
Coating it, it kills it.
And that's one of the reasons why in a recent journal article, it says that just about everybody else, it's 3 days, 3.5 days to relief of pain, just pain.
Right.
Viroxyn is showing a relief of pain in, well, the study showed that the relief of pain was about 10 minutes.
10 minutes. We say less than an hour.
And I say, and in the study they put less than an hour because they didn't think anyone believed 10 minutes.
But it's true. I know
it
that
is
for
true.
a fact. I've treated hundreds of these with Viroxyn.
And we also know that with Viroxyn you go from a healing time of about 10 to 12 days, something in that 10 to 11 days median.
If untreated.
If untreated, 10 to about 3.5 days treated.
Right.
And the good thing about it is, it's an interesting medication in that it can be used at any point during the life of the cold sore.
Right.
So when people get cold sores, this is very common, there's a state called a prodrome state.
Little tingle right there.
Little tingle. Some people it's a little more severe, it's burning, but they know they're getting it.
Yeah.
If you treat then, you've got an excellent chance with Viroxyn of never even having the occurrence.
I've done it many times. Absolutely. Never even get the cold sore.
Right. And the point is that it is a simple to use medication. It is a guaranteed to work medication.
Right.
And very honestly, we're giving the dentist, and by the way, it's not just the dentist, we're giving the entire dental office a new tool. We see an opportunity here for the hygienist. We even see an opportunity for the front desk person to be able to take a history and say, do you get cold sores?
Right.
And make sure you come in if you have a cold sore, because we can treat for you. Absolutely. We can do something. And then the hygienist, it gives her another point of conversation and a treatment that she can do right away. But it's another point of conversation that says, this office isn't just concerned about your teeth.
Right.
This office is concerned about the total patient.
Right.
We care about the total health of you. We care about everything. So just because a little bit outside of the mouth, we see it, we can help you with it, we want to do it. And I have to tell you, Mike, one of the interesting kind of paradigm shifts here is that here we're going to a dentist.
Yeah.
And the shift is taking a person out of pain.
That's a good
thing. Instantly.
That's you
know, and that's something you want to be able to say. I mean, that's important.
Absolutely.
Right.
You want to market this, you want to promote it.
Absolutely.
And that brings us into the possibilities with this. Not only are you a hero to your current patients for taking care of them, but you can use this as a marketing tool to get new patients. I've seen dentists market this publicly, you know, on print or radio or TV to get new patients. Say, we treat cold sores maybe free for the first time and then sell them vials thereafter. And so that's a possibility. There are a lot of ways you can build your practice.
We see a lot of, we see obviously lots of opportunities. The most important thing, as you and I both know, Mike, is first of all the health of the patient.
Absolutely.
But bringing them in for something that is an immediate high impact treatment, something they can do, doesn't take a great deal of time. 2, 3 minutes, 4 minutes of education can change that person's life.
It can.
And you have a situation here where you can bring a person in a very, very low cost environment. A treatment of Viroxyn purchased by a dentist runs, let's just say can run under $10.
$7 to $9.
Something in that area based upon how you buy it.
Right, the volume of purchase that you do.
Right. Obviously that's like anything. But we have, we've also, in the new manifestation of Viroxyn, we've changed the kinds of packaging we have. We've had dentists talking about how you build your practice with it. We've had some say, we don't want individual packs. We would like to have something where we can have, a dozen.
Right.
Where we can, treat on the spot.
Right. Use that in your office.
Use it in the office, and we've packaged that in a small package. It's easy to store. We've taken everything in consideration. We understand how packed the dentist's office is.
Right.
So it's an easy store. The other thing is we then have now a 2-pack.
Right.
So a dentist can make a decision to treat with one and give the other. One of the things about lasers and things like that, in-office treatments that don't go with you, are that sometimes with cold sores, in about 15% of cases, you'll get one, you'll heal that one, but because the viral load still exists, you might get another one.
Exactly.
A day or 2 or 3 later over here.
Right.
Well, if the dentist has treated you and sends one home with you, you can handle that on your own and know how to do it and get it done. You're not going to go back in for another laser treatment.
Right.
You're not going to go back in a couple of days later, and that's expensive. That's really expensive.
And then the other thing is, if someone's on vacation or they're just not able to get into the dental office, if you provided this for them to take home, then they've got it there to treat. You're a hero.
Right,
You're
absolutely.
an absolute hero for doing that. Right.
Well, and that's another reason why is, we've historically had a 3-pack. We've also said, treat and give a 3-pack, or treat and sell a 3-pack, whatever suits your practice style. Exactly. Because let me tell you, we've known practices that have done 3-packs and given them away. And I'm going to tell you, when you figure it costs $125 to $225 to attract a new patient, to give them something that costs a few dollars, and you put your name on it, and the next time they get a cold sore, they see your name stamped on that, and your practice, they're going to remember who you are, and they're going to come back.
And they may give it to a friend who's got a cold sore, a family member.
Absolutely. We hear that all the time. We hear people say, I got this from my neighbor who uses you, doctor. Can I come in and get some? Well, sure you can. I'd be thrilled to have some more traffic in my practice, right?
Absolutely. So we've got a 12-pack for the office to use that as they treat patients. And you can treat up to 12 patients with that.
Absolutely.
We've got 3-packs and we've got 2-packs.
Correct.
Now let's talk about reimbursement or charges in the dental office. Some insurance companies will even cover this. I typically see dentists selling Viroxyn in the neighborhood of anywhere from $16 to $45 per vial or for 2-pack. But then also, if you do want to charge for the treatment in your office, some insurance companies we've heard will pay up to.
Well, it's really we've heard up to $90 for a palliative treatment.
Treatment code.
Right, for that code. So it's that's a choice, obviously, that a dental office can make. But let's just talk about it from the point of view of a sale point. A 3-pack or even a 2-pack. Because it's a single dose treatment, so each vial, you get 2, you have treated 2 cold sores, so you may have one now and you may have one 6 months later or 8 months later, is cheaper than anything you can buy on the market anywhere.
By far.
By far, right. There's I guess one of the leading products out there ranges somewhere between $23 and $27 a tube. For essentially it's a topical balm. It's kind
of like a lip balm.
It's like a lip balm.
The spread of the virus doesn't really kill it.
Right, and part of that is some people use more than one tube per over the 11-day period of the cold sore. and it's more than one tube. Some of them use 2 tubes. I've heard of people using 3 tubes. So you're talking $60 to $75 to $90 for the treatment of one.
It doesn't even kill it. Lasts longer than if you treat it with Viroxyn.
Right. And yeah. So I mean, you know, the economics of it, even at point of sale,
right,
is even cheaper than something you can get OTC, and that's kind of an amazing thing for something that works so well.
Super. Neil, is there anything else you'd like to tell us about Viroxyn or oral herpes cold sores before we close?
Well, I tell you, the most important thing in my mind, you know, I come out of a public health background, and the concern for people knowing about this, you know, the business is great, but for a dentist to expand their horizons and to expand their patients, look at them as people, as medical professionals, is invaluable. Because as we move in our economy and the way things are going, the dentist is more and more, and the hygienist, by the way, are becoming more and more a point of contact for just about every health issue.
Absolutely.
Once again, here's an opportunity. And in the old days, I think you may remember, Mike, I used to deal with tobacco cessation and oral cancer. That was a hard one for dentists. I can understand. That's a difficult conversation. I don't want to talk about that. Here is something that you can talk about the contagion, have a truthful message, have a good conversation with someone, and very frankly, for some people who get cold sores 3, 4, 5 times a year, at 2 weeks a shot, you're talking about a serious piece of their life that you're giving back to them, while simultaneously doing good for your practice. So it's an addition to your practice that's different than other things. You know, if I could compare it to anything, I'd compare it mostly almost to whitening. It's something that people want, people you want to bring them in for, and very honestly, it's a new category.
It's a whole new category.
There's not a lot of things out there treating. It's not like you're saying, well, I'm going to change my filling material from this brand to this brand. No, this is the brand. This is the only product formulated and made exclusively for dental practices. It is the only one designed just for the medical professional. So we think it's a good idea.
And it's the best one.
Thank you.
Dentistry can be an army of preventive individuals to bring this message to the world.
Right.
The dental offices can be an army, and that's what we want to do. Neil, thank you so much.
Thank you very much. Great to see you. Thank you, Doc. Appreciate your time.